so much. This is wonderful, and I've been looking really forward to speaking to Dr. Burnett. Dr. Patrick Burnett is on right now. Hello, Patrick. How are you?
Hi, Dr. Bhargava. Nice to meet you.
Great to meet you too. I was really looking forward to this. And before we get started, I would love for you to introduce yourself to the audience and just give us a little bit of what you've done. You've got such an amazing career.
Thank you so much. I appreciate the invite to speak with you today. Yeah, so I'm the Chief Medical Officer at Arcutis Biotherapeutics. Arcutis is a medical dermatology company, and we're really focused on addressing the most persistent challenges for patients with immune-mediated skin diseases. And this fits really well kind of with my background. I'm a dermatologist by training. I did an MD PhD during my medical school, and then did a dermatology residency and spent about 6 years in academic practice at Vanderbilt, where I had the opportunity to train residents and care for patients. And then an unusual opportunity presented itself to move actually over to the corporate side for pharmaceutical development while still staying in dermatology. And so I've spent about the last 12 or 13 years developing drugs for patients with skin disease and had a really amazing experience with that. And kind of as I think back over my career, I originally had a plan to work in academics, trying to kind of skin disease, which was my passion, along with the science that I worked on during my PhD. And after spending about 6 years in academics, I realized that another way it could be done that was a little bit less typical of a career path was to actually work on the side of companies where you have a different set of resources and also, kind of direct access and really amazing opportunities in the form of the therapeutics that they're developing.
Yeah, absolutely. And look, I mean, we, as physicians, as healthcare workers, we definitely want to do what's best for the patient. There's many ways to do that, right? So, I mean, I applaud you for the work that you're doing and the work that you've done. And, especially in dermatology, there's certain areas that are just really difficult for patients. And would love to chat with you about that. So, specifically, clinicians are definitely trying to do their best to help in areas such as atopic dermatitis, seborrheic dermatitis, psoriasis. What are some gaps that you think might exist for clinicians in terms of just being aware of how to treat these diseases?
Yeah, I mean, I think one of the challenges in treating these diseases is that the way that they manifest on the skin can create really a diagnostic challenge for many of the doctors who aren't specifically trained in dermatology. So we get this a lot from doctors who are either primary care or in other specialties where a patient comes in and they have a skin disease, and it can be kind of paralyzing for them to really move forward with a treatment because they want to make sure that they're selecting the right therapy for the disease, but that diagnostic dilemma kind of presents a big challenge for them. And so, I think one of the key aspects for healthcare providers who are treating patients with skin disease is really to have good access to a trained colleague who can help initiate and get the diagnostic component of managing that patient locked down early in their treatment. This is one of the areas that we've identified as a gap. And one of the nice things about being on the side of a company is that you have the resources to be able to do some things like conduct some of these larger polls. So we actually did a Harris poll in seborrheic dermatitis to try and understand what is that patient journey like, not from the healthcare provider side, but from the patient side. So we talked to 300 adults diagnosed with seborrheic dermatitis, and we found that on average, it took 3.5 years from symptom onset until a proper a diagnosis was made and the right treatment was administered. When we asked that same
Wow.
question to dermatology clinicians, we found that they expected that it took about 1.5 years based on their own experience of patients coming to them. So, I think that is one key aspect, is not just getting the right therapy, but also even just getting this like journey to a diagnosis as short as possible for patients.
And that's such a great point, right? Like that is one of the toughest things for patients. They have this disease. they can't get the diagnosis, they can't get the treatment. It takes them a long time. 3.5 years is a long time for patients. And so I love what you're talking about, like how to shorten that journey is so important. Do you think, like, with the inequities that we have in our nation, specifically like the healthcare deserts that exist in certain areas of our countries, and rural being one of them, how can we make sure that clinicians are armed with the information they need to make the diagnosis and select the right treatments?
Yeah, I think one of the things that has definitely helped us in the last 5 to 6 years, and this is a benefit out of the pandemic, is more of an openness to telemedicine. I believe dermatology has really benefited from that, and I have colleagues who have a very robust telemedicine presence. I think that still impeded a little bit, to your point about healthcare deserts, because there is a licensing issue where, in order to care for patients, you need to be licensed in the location where you're also caring for them. So I think that there probably could be more done in order to improve the access for patients, but for doctors, and or access of patients to trained dermatologic clinicians and other specialties. But I do think that as well, the educational resources online have really had an amazing shift. And I think Medscape is a perfect example of this. The ability to bring really high quality training, so that if the desire is there on the part of the healthcare provider, they can learn about from some of the world's experts in a way that really was much more difficult to do and required travel in the past. So I think that there are improvements that are being made that can help to address this in a way that hopefully will continue to move us in a direction that shortens that time to diagnosis and to get appropriate therapy.
I completely agree with you. I think the telemedicine has definitely helped. And I agree with you that, using platforms such as, digital education, our reach is over 800,000 clinicians in the country. And to have access to that information is really important too. So let me ask you, like, you still there, Patrick? Did I lose you? I'm sorry.
I am. You dropped out for just a
I
second. I
am so
heard,
sorry.
let me ask you, and then and then I didn't hear
Technology.
anything.
Yeah, what I asked was, what are some of the key things you would like clinicians to know about the burden of disease in these areas?
Yeah. So, in talking about skin disease in particular, it sometimes can be hard for a healthcare provider who hasn't really, had a chance to sit down and speak with a patient about what is the impact of this disease on their life. Because we oftentimes are thinking about disease in reference to, impacting the length of.
I asked was, what are some of the key things you would like clinicians to know about the burden of disease in these areas?
Yeah. So, in talking about skin disease in particular, it sometimes can be hard for a healthcare provider who hasn't really, had a chance to sit down and speak with a patient about what is the impact of this disease on their life. Because we oftentimes are thinking about disease in reference to, impacting the length of someone's life, or, their ability to even physically, conduct their daily activities. And while many dermatologic diseases can affect your ability to do your daily activities, they typically don't shorten a patient's life. But the burden associated with them is much associated with an impact on their quality of life. And we think about that most commonly in a disease like atopic dermatitis. This is, we teach medical students that this is the itch that rashes. And so it's very, we kind of associate the itch with atopic dermatitis tightly. It's also something we see in children, kind of just like, scratching at their skin very aggressively. And we can see the manifestation of that on the patient. But, as well in plaque psoriasis, itch is the most burdensome symptom of this disease. And there was a really interesting paper that showed that when you ask patients psoriasis how severe their disease is, they correlate that with their itch, not the amount of disease that they actually have on their skin, which is the opposite of what doctors do. Again, doctors, how much disease you have
Mm.
on your skin, and you say, oh, well, you don't have severe disease because you only have a relatively small percentage of your skin that's involved. So there's this kind of disconnect between the burden that the patient experiences and then what you can what you can see. And we have a disease like hidradenitis suppurativa, which causes these kind of drainage lesions in the inframammary area, in the groin, in the armpits, which can be very disruptive to the intimate aspect of a patient's life, as well as causing itching and burning. It's hard to play through what that impact is having on the patient unless you specifically ask those questions, or you kind of have a directed conversation where you really take the time to understand what is that doing for the patient. Because what we learn is that patients really suffer from embarrassment and anxiety, particularly if their skin disease affects visible areas, or their face or their hands. And so I think it's really important for patients to be heard, and for doctors to not shy away from asking questions about how it is that the disease is impacting their patients.
You make such great points, right? The quality of life really matters. And I would also, I would also say that that impacts your mental and emotional well-being too, right, Patrick?
Yeah, no, I completely agree. I don't think that I think as a healthcare provider, it is a lifetime of learning, and every time you sit down with a patient, you're learning something from them. And seborrheic dermatitis was a disease that I thought I understood as a doctor who's cared for these patients for many years. But when we started asking them how it is that this has affected their life, we've had patients say that that it impacted their decision what kind of career that they might want to go in. Like because it
Oh,
causes them,
wow.
yeah, because they're shedding scale from their hair. That then is going onto their clothing. They have a redness on their face that makes them feel dirty, and they worry that people perceive them to have poor hygiene. So we've had patients who have said, I looked for jobs where I didn't have to be physically face to face with people, because it's easier for me to avoid that than it was to kind of have to worry constantly about how I looked when I was in front of them. And I think, well, if we had treatments that had had removed that from the equation, how might this patient's life have been different? And so, I definitely learned a
Mm.
lot from just asking those questions.
Wow, that's just such a great point you make. I mean, we don't like as doctors often we do miss like how deep this penetrates their life, right? And it's something that we definitely need to be aware of. I'll tell you as a pediatrician, the parents that I saw with kids with atopic dermatitis certainly struggled a lot. They were very frustrated. It definitely makes an impact on the quality of.
Yeah, I think you raise a really good point, because the impact on quality of life for atopic dermatitis as a pediatric disease is even more expansive, because, like you're saying, it impacts the parents, both parents. They're, what it is that they care for their kids, the amount of sleep that they are getting,
Yes.
in
Yes.
addition to their kids getting, depending on their age, the amount of time that they need to help their children, because of we know there's this association between atopic dermatitis and ADHD, and disruption in the classroom, and is this related to itch or not? But depending on where you set the scope of your question, that the impact on the family can be so dramatic, and on the other kids, from just a single child who has atopic dermatitis.
Yeah, no, absolutely. I mean, absolutely. I think it really impacts the family.
Parents, both parents, they're, what it is that they care for their kids, the amount of sleep that they are getting,
Yes.
in
Yes.
addition to their kids getting, depending on their age, the amount of time that they need to help their children, because of we know there's this association between atopic dermatitis and ADHD, and disruption in the classroom, and is this related to itch or not? But depending on where you set the scope of your question, that the impact on the family can be so dramatic of your question, that the impact on the family can be so dramatic, and on the other kids, from just a single child who has atopic dermatitis.
Yeah, no, absolutely. I mean, absolutely. I think it really impacts the family. And to your point earlier, Patrick, you know, just because it doesn't shorten the lifespan does not mean that the quality of life, the mental and emotional well-being is not something, and that is a significant issue. And we know, especially right now with the mental health crisis, these are
Yes.
significant issues.
Yes.
So, well, this has been great. And, we're nearing the end here, but I did want to ask you, like, just going back to, you brought up telemedicine, things are changing in the field of dermatology, and, we have all kinds of innovation, AI, all of that. What are your what are your thoughts about like how things are changing?
Yeah, I think that there has been a revolution, and sort of just speaking mostly from the dermatologic standpoint. There has been a revolution of therapies that have come into the, and sort of just speaking mostly from the dermatologic standpoint. There has been a revolution of therapies that have come into the field that have completely changed the way medicine is practiced from when I was a resident. Biologics being able to be very, very targeted and deliver incredible results for patients where, they almost eliminate the disease. But, many of these are on the moderate to severe spectrum. And so we're recognizing now is that patients who may not be appropriate for some of these incredible, groundbreaking therapies are still suffering from a lot of impact of their disease on their daily life. So, I think it's really the change that we're starting to see now in dermatology, as we've had 3 recent approvals for non-steroidal treatments for the most common diseases in dermatology of psoriasis and atopic dermatitis, is looking for therapies that are kind of changing the way that we practice medicine for the last 50 years in a way that should be kind of safer and more effective for patients, even if it's not addressing the absolute most severe patients in that area, because that now you're talking the majority of people who have a condition that tend to be in that kind of like mild to moderate range. And so I'm very happy to see that there is still this kind of focus and interest in expanding the options of treatments for patients, and not just kind of like setting aside a disease and saying, okay, we've got the most severe cases handled and then we're going to move on to the next thing, because that really does leave a lot of patients behind.
Yeah, absolutely. So much work to do and just so many aspects to these issues. Patrick, it's been so wonderful to have you on this. Is there any parting words that you might have just in terms of like our healthcare audience and delivery of this of care to patients?
My one advice that I would really say, and I would say it's a lesson we touched on a little bit that I've learned from kind of working in these diseases, is just like really take a couple of minutes when you're taking care of a patient and just ask that how it is that this disease, whether it's a skin disease or any other disease, is impacting their life physically and
Yeah.
emotionally. And those few moments that you take to really understand can help you connect those patients with the resources that might help them improve their life, even if it may not change your therapeutic choice. So that would be
Yeah.
my one parting word. And I just really appreciate the opportunity to have a conversation with you, Dr. Bhargava.
No, it's been wonderful, Dr. Burnett, and please call me Hansa. And would love to chat with you more another time. I think I love what you're talking about. The quality of life matters, and frankly, that those kind of questions help the patient physician or patient clinician relationship as well, right? The compassion that you bring to the table. So,
Absolutely.
thank you so much, and looking very forward to chatting with you more at another time.
That sounds good. Thanks so much.
Thank you to our Medscape listeners, and until next time, this is Dr. Hansa Bhargava. Bye bye.